I want. time doing this, so. Yeah, no, it works.
You want representatives on one side, senators
Wherever
on the other?
yeah.
You're thinking too much. Yeah. Yeah.
Ready, Eric? Okay. All right. Well, good afternoon, everyone. My name is Tim Ward. I'm the Director of Government Relations and Advocacy for the Pennsylvania Healthcare Association, commonly referred to around the Commonwealth and especially in the state capital as PHCA. And PHCA, we proudly represent long-term care providers across Pennsylvania, most specifically nursing homes, assisted living, and personal care facilities. We're especially excited to be here today in Schuylkill County to stand with members of the Pennsylvania General Assembly and our PHCA member, Providence Place, as we highlight an important legislative initiative, a legislative package that is in the works, and we're excited today to be joined by our Senator Dave Argel. We have Representative Jamie Barton and Tim Twardzik, our Schuylkill County delegation. Representative Joanne Stair wishes she could be here, but an illness is preventing her, so we wish her well. And she actually represents Pine Grove, so best wishes to her, and we hope to see her soon. So why are we here today? Pennsylvania is one of the oldest states in the nation, and the Center for Rural Pennsylvania has projected that the state's 80 and older population will nearly double by 2040. In the long-term care sector, a workforce crisis exists, a shortage exists, and it not only threatens. Did you know that between 2020 and 2022, nearly 26,000 long-term care workers left the bedside? That's a 20-year low, and it speaks to the importance, again, as to why we're here today. Pennsylvania's long-term care providers have been sounding the alarm in Harrisburg, across the Commonwealth, that a workforce shortage exists. Our senior population is growing dramatically, as is the rise of residents in Pennsylvania who rely on our nursing homes, our assisted living residences, and our personal care homes. You are probably aware that in Harrisburg, we have new staffing ratios for the nursing facilities across Pennsylvania to meet, and we're also dealing with a similar proposal in Washington, D.C. that also targets increases in staff in nursing facilities. Let me be clear that PHCA member providers want to retain their current staff. They want to fill the thousands of unfilled positions that exist today, but we're looking for Harrisburg and Washington, but in this instance, we're looking for Harrisburg to provide relief. And again, that's why we're here today, to highlight a workforce package that takes aim at the long-term care workforce crisis. Earlier this year, PHCA and our members identified barriers of entry into the workforce, and these barriers are the target of legislative initiatives. You've heard the numbers. We don't have time to waste. The time for action is now. And just briefly, want to go through the Senator's initiatives. Initiative 1 is to modernize the nurse aid training program. This is for CNAs in our nursing facilities. Simple things like ensuring that student nurses and graduate nurses who are already being trained in very similar way, if not higher, that they can, upon completing and join the rank of nurse aides to the bedside without delay. We're also tasking the Department of Education to create one statewide nurse curriculum for nurse aides so that we can send instructors to Harrisburg to train, to deliver that curriculum, and then in a more efficient manner deploy across the Commonwealth so that we can stand up more nurse aid training programs to hopefully grow the number of CNAs, the availability of that next crop of employees. The second initiative on the assisted living and personal care side, and we are standing in one of those facilities today, is to tear down a regulatory barrier that says you need a high school diploma or a GED equivalency to train as a direct caregiver. And what we're saying is that there are plenty of folks in Pennsylvania who do not possess a high school diploma or a GED equivalency, but they possess the skills to serve as a direct care worker. So we're asking the Department of Human Services to provide a skills competency evaluation so that those individuals who may not have gone through your traditional basic K-12 education, that they can prove their skills competency, pass it, and then join the ranks as a direct care worker upon training in assisted living and personal care. And then the third one is targeting the next generation of caregivers in Pennsylvania. We're asking that high school juniors and seniors be able to earn course credit for serving in various roles in nursing facilities and assisted living facilities, personal care homes, that they not only can obtain course credit, but they'll be also getting paid by the providers. So it's a little on-the-job training. It's to incentivize the next generation of students who are coming up and soon making a decision on what their career path is, to expose them to careers in long-term care, because too often we've seen that folks they're not exposed to long-term care in a positive way in their younger age, and showing them that these are valuable careers, these are necessary careers, and the goal will be that not only it helps fill valued and needed positions in our facilities, but at the same time that we have the first shot at converting some of those students into careers in caregiving, and that they might actually remain in our facilities upon graduation. So that's the workforce package in a nutshell. Before I turn it over to Senator Argle, who's going to give us some remarks, I just wanted to take a moment to thank Schuylkill County State Senator. I approached the senator and his staff several months ago about the challenges of workforce and long-term care and our proposals to target and tear down some of these barriers. It took the senator all of 5 minutes to sign on and say, "How can I help?" and agree to be our prime sponsor. So Schuylkill County, you're lucky that you have Dave Argle representing you in the state senate. I'm lucky, and PHCA is lucky to have him as an ally. Senator Argle truly understands the challenges facing long-term care providers, and as the chairman of the Education Committee, he's uniquely positioned to do something about it. So we have the right sponsor, and I also just wanted to give a quick shout out. I'm a former legislative staffer, and I wanted to give a shout out to the senator's staff as well, who have been working with myself and PHCA staff, not only to help really hone in on these initiatives, but to start drafting legislative language so that we can hit the ground running once these proposals are formally introduced. So, Senator, thank you for being here today. Thank you for sponsoring these 3 initiatives, and I'm proud to introduce Senator Argle.
I think Representative Twardzik and I were talking a little bit earlier this morning on our coal mine tour that these kind of facilities have just helped so many of us, our parents, our grandparents, our friends. I know it's not an easy decision when someone finally understands that they need help, but we truly would be lost without this kind of professional guidance. And so we have all seen firsthand the love and the caring that staff can provide on a daily basis. We also understand that the world is changing, and that many of our long-term care centers are struggling because they cannot find enough qualified, well-suited employees. We keep hearing again and again that with these positions becoming vacant, that these beds, these rooms that are so much needed, have had to be taken offline because of the lack of qualified staff. The U.S. Department of Labor has reported that in the last 4 years, we lost 14% of this vital workforce. And so in order to give the workers and the residents a boost, as Tim has indicated, we're presenting legislation to encourage more people to enter this field. Bills are designed to eliminate some of the requirements that have prevented people from becoming caregivers, common sense changes that will help Pennsylvania grapple with the rapid increase of Pennsylvanians over the age of 65. I used to think 65 was. I no longer think that. Okay, it's funny how your perspective changes. That age group, of course, is about to double in the next 17 years, and so the bills that we are working on have already, just within a few weeks, obtained significant bipartisan support with a large number of co-sponsors, including Senator Michelle Brooks from Northwestern Pennsylvania, the chair of the Senate Health and Human Services Committee. Senator Collette is a Democratic member from Montgomery County who is, in addition to being a senator, a nurse and an attorney. Senator Boscola, a Democrat from the Lehigh Valley. Senator Gebhardt, a Republican whose district is just on the other side of that mountain in Lebanon County and Berks County. Senator Judy Ward, another former nurse from a Republican from the Altoona area. Senator Rothman from the Camp Hill, Harrisburg area. Senator Pennycuck, one of our new members from southeastern Pennsylvania, Montgomery County. Senator Schlegel Culver, my neighbor from up in the Bloomsburg area. Senator Hutchinson from Oil City. Senator Farry from Bucks County. So I think we have a good combination of new senators and veteran senators, Republicans, Democrats, literally small town, suburban, and urban. And so I think that is just the beginning. I suspect we will have even more co-sponsors in a few weeks. And I think, too, what we should note that in a time when partisanship continues to grow and grow and grow in both Washington and Harrisburg, we're proving that on this issue, we have the ability to come together and work together. Simply, again, common sense legislation to benefit all older Pennsylvanians, to provide the chance for quality care for more families. And so I want to thank our friends at the Healthcare Association who have worked with us in crafting this legislation. To Josh in my office, I probably don't say thank you enough, Josh. Thank you. It is much, much appreciated. Want to thank all of the representatives for their support and guidance on this legislation. We're going to need them once we get this approved, and so I'm glad that Representative Twardzik and Representative Barton were able to join us. And Representative Stair, with her background in nursing, understands that when she is ill, this is not a good place for her to be today. And so she, too, has been very helpful. And so to all of the workers who provide this care in Pine Grove and beyond, thank you for all you do. We truly do owe you a debt of gratitude. Thanks to all.
Thank you, Senator. I next want to call up David Leader, who's the president and CEO of Providence Place. David.
Thank you very much, Tim, and I'll be brief. First of all, I want to welcome all three of you to Providence Place of Pine Grove. We're proud that you're here today, and we're thrilled that you're here to announce these three legislative initiatives that really will help our industry at a time. I was looking at Julie Wallace, our executive director here in Pine Grove, and she and I have both been working in this field for about 25 years. And I can say without any question that this is the most difficult time we have ever had for finding staff, for keeping staff, and for training people to do this important work. And so these efforts that you're making are really going to make a difference to us and to the seniors of Schuylkill County and all of Pennsylvania. So we thank you very much. And I also want to tell you that we're happy because you represent this part of the state, an area where we have several communities, and it's a real pleasure to have the chance to see you in person and thank you for your good work. Thank you all very much. And we hope you'll tour the facility when you have a chance. Thanks. Take care.
Thank you, David. Next, I wanted to call up, give both Representatives Barton and Twardzik an opportunity to address you all. And we're looking forward in the next, hopefully, this session, getting these three initiatives out of the Senate and on to the State House, where these two fine gentlemen have the opportunity to cast an affirmative vote. So, Representative Barton.
Sure. Thank you. And I'm looking forward to passing an affirmative vote on this package of bills. And Senator Argall, this was a wonderful and long needed. I think the people standing before us here are can attest to all of that. And whether you're an administrator, a CNT, RN, LPN, at whatever level, we know and we've listened and we've heard, and this is a really common sense response. When you have a passion, when you have a desire to take care of others, to be the caregivers that you all do at whatever respective, whether that's in the administrative capacity, whether that's hands-on working with the patients here. It's a ministry, isn't it? It's really a ministry of love, of care, of devotion. And sometimes you've realized that you didn't eat breakfast or you didn't eat lunch and you've missed a meal and you're all laughing because it happens. And it's because you are caregivers, and this is designed, this package of bills is designed of common sense to take that same level of passion that people have for giving of themselves to helping others. And it does it, the best part about this, it does not reduce the quality of the people. What it does, in my opinion, is it enhances somebody that has a desire to help and move their career forward in healthcare, and we know we need it, and we're looking forward to it. Senator Argel, thank you for doing this. We're backing it 100%, and we're looking forward to it. Thank you all for what you've been doing. We know that it's been hard, and we're looking forward to helping in the best we can as well.
Thank you, Representative. Personally, I have a lot of experience with the Providence Homes. They took care of my mother in Pottsville, did a great job. Like the usual story is, I'm not sure I'm ready to go. And as a family, we're worried about you being at home alone. And it gave us, as a family, great pause that we knew she was going to be taken care of. She got there, she flourished, she really enjoyed meeting other people because she's a social person. Instead of being locked away in your home, she had a chance to be cared for and meet and greet. And it was really nice. It was a tough time during COVID, but the angels who work in this Pottsville operation and here, they really are angels. They do take care of the people, and this bill is wonderful. You're going to be able to bring more angels to work because it's a calling, and we really appreciate what you do. And I'm looking forward to sponsoring and supporting this as it comes through. The good news is you've got a wonderful package of senators on this already, and that will get us speedily along. The bad news in Harrisburg is sometimes takes 6 years for a bill, but not a good bill like this. We'll get this done right away. Thank you.
Cross your fingers.
Yeah, cross our fingers. Just to close, I wanted to thank Providence Place for opening your doors to us, for the members of the General Assembly for coming out and showing your support to the senator and his team for continuing to work with PHCA. Just a final note, PHCA, we are the leading advocacy association for long-term care in Pennsylvania, and when we see problems, it's not something that we're accustomed to just complaining about. It's truly about taking action. And so we're excited to take action on behalf of our members, on behalf of Pennsylvania's caregivers, our providers, and most importantly, those that we care for. So thank you all for joining us today. We're going to go inside and do a little bit of a tour and meet with some residents. Have a happy Thanksgiving and a good weekend. Thank you. Thanks, Senator. Of course.
Thank you so much.